Good morning. I'd like to call together the Northern Michigan University Board of Trustees Academic Affairs Committee. Present, we have Trustee Lisa Fatante, Trustee Sepinen, and ex officio Chair Savoy, and President Schuling. We've got 3 agenda items today. They're all going to be information only. I'd like to first invite Norma Frolick, the chair of the Academic Senate, to give a Senate update.
All right, thank you very much. And also thank you again to the Board of Trustees for meeting and greeting with a number of the Executive Senate members last night. I chatted with them after the fact, and a lot of them were really encouraged by the conversations we had and that some sense of where we're all going. So in any case, I am here to report on the activities of the Academic Senate and the recommendations that we've made to the Provost Vice President for Academic Affairs in recent months. Since I last presented to you in October, we've reviewed and recommended to the Provost a number of undergraduate curriculum changes, including several that I had actually listed as pending in my written report 2 weeks ago that have now been approved as well. Those changes include 2 new courses, Introduction to Information Resources and Gender and the Environment, 4 changes to courses in the Native American Studies program, reflecting the indigenization and decolonization of that curriculum, program changes to 2 majors and 4 minors, and then 2 program deletions. A journalism education minor that's being phased out because the related teaching certificate is being phased out by the Michigan Department of Education, and then a public history minor that is being discontinued because of insufficient staffing largely, and then also some low interest. Other things that Senate has been doing, we have had several guest speakers this semester. Dr. Steve Van Avond and Mr. Brad Hamill met with Senate in October to discuss the relationship between academic affairs and the Global Campus program. A number of the questions we'd had were clarified, and while there are still some concerns about the current structure, we're going to continue working to develop and deliver both online and in-person programs, I should say. And I guess in terms of what's going on with that, we're perhaps in a little bit of a wait and see mode. As I know, Provost Kapla and Vice President Van Avond are actually having conversations on a structural level. So sort of the Senate faculty responsibilities are perhaps a little bit on hold right now. Other things, in October, Dr. Dan Cullen presented to Senate on changes to the Higher Learning Commission requirements for reporting curriculum changes. And then also in our last meeting in November, Dr. Chris Greer spoke to Senate regarding a pilot program that's starting in January to contract with NAC Tutoring, a company that will recruit, train, and pay NMU students for an all-hours peer tutoring service that will become in addition to the already existing services on campus. Those were really just kind of informational items and discussions within the Senate. Coming up, our Committee on Undergraduate Programs and our Grad Program Committee anticipates submitting a lot more curriculum proposals for Senate review, and hopefully we'll then be recommending those to the Provost in the winter semester. Our other committees are also continuing to work on a range of issues from library funding, internationalization on campus, and academic policies. And one concern that we are starting to get into is development of policies regarding requirements for certifications or badges or micro-credentials, and even the question of what we would be calling these things, which of those words we'd be using. Currently, there is no policy here, and apparently there are very few universities around the US that have policies. But that question of how to structure those certifications to aid the ever-changing needs of current and future students. It's a conversation that's gone on in Executive Senate that I know is happening in extended learning and community engagement as well, in the registrar's office, kind of all across the university. So hopefully we'll know something more about that sometime soonish. So, other than that, Senate meetings, they continue bi-weekly throughout the academic year. And if any of the Board of Trustees is interested in attending, please consider this an open invitation. Send me an email and I'll get you in. So, Any comments? I welcome comments, questions now or over the next year. Thank you.
Thank you, Norma. Just a comment from my side. I'm really pleased and encouraged to hear about the discussions taking place regarding Global Campus, and hopefully there's more transparency and understanding about the structure, which it sounded like there was just clarifications needed, but also it sounds like there's a path forward to continue to work collaboratively to ensure that it's understood, it's equitable, and I'm looking forward to hearing what comes out of that. So also, thank you always for the open invitation. You're very consistent about that, and looking forward to attending at some point. Any other comments or discussion from any of the committee members?
I also want to thank you. I know that the work that you do helps us to be reassured that the rigor and that the consistency of the educational product we're delivering here is very strong. Thank you very much.
And I should say it is the Senate. I'm their mouthpiece, and the Senate is a really amazing group of people. So.
Thank you, Norma. All right, next on the agenda, we're going to hear from Dr. Casey Holder and get an update on our charter schools.
Thank you. Good morning. So a couple of quick pointers regarding the memo that was forwarded. Item number 1 is the board appointment. That's just informational. Item number 2 and 3 kind of go hand in hand. So the NACSA supplemental guide and the dashboards. So what to just quickly say, in case you're not aware, the dashboards were first implemented by the Charter Schools Office in the fall of 2014 by my predecessor. And in the fall of 2017, when I took over, one of our first tasks was to design a performance framework for our schools. And the dashboards that you see in your information packet were first presented to the Board of Trustees in the fall of 2019. So as you're clearly aware, in March of 2020 was when the pandemic hit. And so the dashboard that you have is been implemented, but probably better incrementally rather than wholesale fully implementation. And I'll talk about that in just a quick second. So that's the timeline of where we've gotten to where we are. And in terms of most recently in 2021, NACSA, our association, National Association of Charter School Authorizers, produced a document called the Supplemental Renewal Guidance Document. And on page 3, which it looked like this, one of they identified 4 major areas for authorizers to be considering when thinking about the effectiveness of their schools. And those 4 areas: student impact, evaluating internal assessments, quality of redesign, and family partnerships. If you recall, last year we provided or offered a 2+3 contract to Burton Glenn. And so one of the things that I required Burton Glenn to do was to actually use that supplemental guidance to align to the data that they are collecting and some of the activities that they have been doing since March 2020. And so when I bring forward a recommendation to you all regarding Burton Glenn in the near future, it'll be based upon this supplemental document and evidence that they're creating and collecting to better show effectiveness that might not appear on our dashboard. And so one of the things that I did in October was I used that framework as part of our workshop to all of the 9 schools, teachers and leaders. And then in April of 2022, I'll be introducing that supplemental document more formally to the boards of those 9 schools and asking all of the boards to start using this framework as a supplement to enhance our performance framework. So one of the things that I have also done this fall is our monitoring team that goes and does site visits and interviews with the staff and students and teachers, et cetera, at the school is using that framework to guide and align their document. So our office has not only introduced it to the boards and schools, we are now collecting evidence on the effectiveness of whether it's actually being implemented at the school sites. So that's going to be a very important data set as we look to enhance our existing performance framework. Turning to the dashboards in particular, I did provide just a snapshot on page 2 of the dashboards. And going through the 3 primary areas of academics, finances, and organization. Academics is to be expected. It's dropped. Just this past week, there was on Tuesday night, there was a collaboration between the Michigan Department of Ed, faculty from Michigan, Michigan State, and Wayne State did an analysis on the state data last year. And go figure, they found that there's been an increase in students in the not proficient categories. And so like in ELA and math, they've both dropped over 6%, or in other words, they've increased the number of students in those lowest categories. So that's kind of a scary finding in terms of the state as a whole. And what's even more scary is that one of their conclusions, and I'll just read this, it's only 2 sentences. Moreover, many of the reasons why a student would not participate in testing, insufficient access to technology, or absence from school may also negatively affect student learning. Given these differences, the results discussed in this report most likely overestimate student performance and learning growth during the previous year. So we already have a clearly identified drop in performance, and they're actually saying that that's probably overestimating how it looks. So it's going to be really interesting to see how the state looks at assessment data in the next coming years. What that means when the rubber hits the road is it's most likely that cut scores are going to have to be reduced or re-examined because the nature of the students where they're at is basically behind grade level. So that's just kind of a big picture on achievement. There are 2 points about the financial framework that are very important to update you on. So the middle point there, Francis Ray was read for an independent audit. That has been completely cleared. It was not the fault of Francis Ray. It was a miscommunication between the auditor and Francis Ray and the MDE. So that one's check mark, gone, it's done, it's completed. The bullet point that I wrote in the memo actually probably shouldn't have written it this way. It says that it was read due to not getting their paperwork submitted. Well, when I wrote the memo, that was accurate. But what happened was the auditor did not provide the audit. So although Nottawash has all reds, it wasn't Nottawash's fault. It was that their auditor has not provided the audit. It is supposed to be submitted to the school actually Monday. Last night in the board meeting, we required the school to address it with their board, and they are considering changing auditors, which is one of the suggestions I made. They needed a few stricter guidelines in their contract because, like I said, it was not their fault. As an office, we're not overly concerned because the school does have a very solid fund balance, and they will resolve this very soon so that they would get their state aid back, but it might take a month for it to cycle through. So that one I'm not too overly concerned about. Lastly, near the bottom of that, the dashboards are, through office conversations, we've decided to implement using the dashboards in our April board meeting rather than having the boards talk about it in January. So that's just kind of a delay. We're going to have a whole hour-long session with our boards. So tried to get under 5 minutes. Can I entertain any questions or comments?
Any comments or questions from any of the committee members? Nope. Okay.
You always do a very thorough job. Thank you so much.
Well, thank you. To end on a positive note, go see Elf if you haven't seen it. I saw it Wednesday night and it was phenomenal.
Going tonight.
Happy
Going
holidays.
tonight. Thank you, Casey. Okay. The last agenda item, we're going to receive a department update from the Counseling and Consultation Services. So I'd like to welcome Professor Jennifer Gordon, Dr. Christina Hartline, and Professor Jean Cooper. And I hope I'm pronouncing the last name right. Cooper?
All right, good morning, everybody. I am Dr. Hartline, and these are my coworkers, Dr. Cooper, Dr. Gorton, and we all work at the Counseling Center. We want to thank the Board of Trustees for inviting us today. We're all very passionate and very proud of what we do for our students and for Northern. So whenever we get a chance to share that information with anyone, it's very exciting for us. So the first half of the presentation today, we're going to give you an overview of kind of what's happening across the United States in particular in terms of college students' mental health. And the second half of the presentation, we're going to focus in on our specific counseling center, kind of what we do and where we want to head into the future. So it's been well established. Mental health issues are very prevalent, especially in college students. Our college counseling centers across the country are seeing both a higher demand for services and a broader spectrum of severity when they are presenting for services. So the data I have for you today comes out of Penn State, which houses the Center for Collegiate Mental Health. They do an annual report each year. And Northern, we do contribute our data as well to this project. So the CCMH collects data through routine clinical practice from college counseling centers, and it has created the largest practice research network of its kind. The most recent report, over 400 colleges across the US participated in it. And it's important to note that the data is from students who are actually seeking services at our college counseling centers. So this is not data of the student body as a whole. It's specifically students coming to the college counseling centers. It's not a survey. The data are collected from the actual counselors who are seeing these students. So we provide information as to, for example, what the students' presenting concerns were and their goals for treatment. Some statistics that I thought were really important to kind of show what's going on is that students coming to college counseling centers self-reported lifetime prevalence rates of non-suicidal self-injury. So that would be, for example, if a student's cutting themselves, but it's not with the intention to die, is at about almost 30%. Serious suicidal ideation in their lifetime was almost 37%, and having a history of suicide attempts, almost 11%. And these numbers all increased for the 9th year in a row. The rate of prior counseling was at 60%, which continued to show an upward trend for the past 8 years. To put it in perspective, back in 2012, the annual report showed that about 48% of students had prior counseling. So why is that important to know? Well, when students come to college settings, they already have had, some of them, very extensive histories of receiving mental health services. And a lot of them, it was long-term counseling. So they're coming to college and they're kind of expecting to continue this trend. Also, about 1/3 of students reported that they had taken prior medications for mental health reasons, and 1 in 10 had actually been psychiatrically hospitalized. About 27% endorsed that they felt the need to reduce their alcohol or drug use in their lifetime, but only about 2.3% actually did receive treatment for that. So 2 key trends that the reports in 2015 and 2016 really wanted to make people aware of is that the average level of individuals wanting services at counseling centers grew by 30 to 40%. So that's how many students are coming to us wanting services. But the average institutional enrollment was only 5%. And over 6 years, college counseling centers' resources devoted to rapid access services. So this would mean basically like a crisis situation. Increased by 28% on average, whereas resources allocated for routine treatment decreased by 7.6%. So in essence, what's happening is we're seeing students who are presenting with more severe issues, they're in crisis, And of course, we have to address those right away in the moment. And when we're doing that, it's taking away time from the ongoing counseling that you would usually think of when you think of mental health therapy. And now Professor Gorton's going to talk a little bit more about JED Campus and the research they have done about mental health in college counseling centers.
All right, good morning. In 2017, NMU partnered with JED and Healthy Minds to assess the mental health needs and resources of our students. So Healthy Minds Network supports universities like NMU with survey studies that examine student mental health and then related issues. JED collaborates with universities, again, like NMU, to build upon existing student mental health resources. To date, Healthy Minds has administered over 550,000 surveys, and JED has worked with over 350 institutions. So with this wealth of knowledge, they provided NMU with the following economic analysis, which is outlined up here. So number one, campus counseling services work, and they help reduce student mental health symptoms. Two, mental health issues such as depression and anxiety put students at risk for withdrawal. Counseling supports reduce this risk and promote retention. Three, mental health is correlated with higher satisfaction in college, and college satisfaction improves the likelihood of donations after graduation. So in summary, college counseling services work. Our departments are an important part of campuses. We contribute to student mental health, retention, and this translates to money for NMU and can lead to future alumni donations. So more about who we are. As you can see, this is our department here on campus. Pictured are three of our clinicians or our therapists. Christy already introduced us, but I'll go again. Jean Cooper is a licensed clinical social worker. Dr. Christy Hartline is a psychologist. I myself, Jennifer Gorton, I'm a licensed professional counselor. And not pictured is Lynn Vadine. She's the newest member of our team and is also a licensed professional counselor. She actually started just very recently at the end of November. So prior to that, this semester, we have been offering these services to students with 3 clinicians. And we're looking forward to having Lynn on our team and having 4 of us support our students next semester and ongoing. Also pictured is our acting department head, Dean of Students, Dr. Chris Greer. And then last but certainly not least, not pictured, also a recent member to our team is our secretary, Tina Manhennick. But she's become even though she's new to our department, she's really become our anchor. So as therapists, you can see our credentials and licensings are all underneath our pictures. And so you can see we come from all different disciplines, which provide our students with a well-rounded services. Speaking of services, this is just a brief overview of some of the things that we provide and how we support students. So number one, kind of the thing that people think about right away with counseling is individual and group therapy for students. We also coordinate care, which means referrals and communicating with different departments on the behalf of our students. Now, all of our services are confidential. And so when we do that communication, it's with the express permission of a student and with written permission, actually. We do provide consultations for all NMU faculty, staff, and students. This is really a joy part of my job. I enjoy talking with people who have questions about the services they provide or just looking for some guidance with different issues. We also do psychoeducational and presentations such as today and outreach programming. And then again, an overview of our department. As I said, our services are strictly confidential and free, and those are underlined because those are very important for our students. We offer same-day appointments for emotional crisis. So if a student self-identifies that they are having an issue that they feel either can't wait to meet with their ongoing therapist, they can come and request an appointment, and we work with them in a single session. We address mental health and developmental concerns, which again is important. We're dealing with a very special population that is transitioning from childhood into adulthood. And so we support students with issues such as homesickness and transitioning to college and what that looks like, as well as anxiety and depression and the mental health concerns. So we really run the gamut with supports. We follow a brief counseling model. So with students with longer term needs, we do refer them to community providers. And again, that's that coordination of care. We want to make sure that our students are getting the best resources and the best supports. Sometimes that's through our department, again, with our brief counseling model. Sometimes they're looking at longer term supports. And so we're referring to them who can better meet their needs. We're very transparent with this model. It's important for our students to recognize that because we're offering services for an entire student body. We want to make sure that we're meeting with students in a brief model, which is usually 4 to 6, like averaging 5 sessions. We want them to be aware of that. So students, as Christy was talking about, who are presenting with more long-term concerns or have been in therapy for years, we want to make sure that they're aware of our model so that they can research and get hooked up with services in the community. We are a rural community with limited resources. We want to make sure that our parents of students and students themselves are aware of that. All right, and then the remainder of our session, my colleague John Cooper will be presenting.
Good morning, thank you. In the fall of, or actually in the summer of 2019, our department, after what Dr. Hartline mentioned, recognizing that how we're providing services could not continue the same model, research and looked at other ways college campuses will provide mental health services. And we adapted what's called the STEP model. After research and visiting several universities in the United States, we decided in order to keep up with the high demand for services and also provide the best care possible for our students who are experiencing mental health concerns, we adopted this new STEP model. This service delivery model is used in many universities. It's a system of delivering and monitoring health treatment so that the most effective, but yet least resource intensive treatment can be delivered first, which is important. Stepping up to the more intensive level of care is it done toward the end or as services are identified as more needed. The model is found on the following: to minimize wait time for psychological services, and that different people require different levels of care. One treatment does not cannot handle all types of issues. So, but we're more instead, we try to individualize our treatment plans for each student's for their needs. The STEP model, students are scheduled first for a phone screening appointment with CCS. During the phone screening, the clinician will determine appropriate level of care, and it could be any of these steps. Refer to community providers, refer to our therapy assistance online program, face-to-face with a clinician for individual therapy, group therapy, or maybe an off-campus referral. Students who are deemed appropriate for counseling are then scheduled for short-term modality of treatment, as Jen Gordon and Dr. Harling had mentioned. Usually these are 5 to 6 sessions. The students can then choose whether they want to be seen individually in the office or telehealth, as we adopted during COVID. Some issues cannot be addressed through telehealth due to clinical concerns of safety, and those are not then are seen in the office. We do provide therapy to students through telehealth if they're located in the state of Michigan. Due to our licensure and state regulations, we can only provide therapy to students who are residing in the state of Michigan during their sessions. And also students would have to establish with the therapist for safety regulation, if they're out of the city of Marquette, local emergency services, local hospital information, and then making sure that they're in a confidential room, that they're not going to be interrupted during the telehealth service. During the STEP model, we continue to provide emotional crisis appointments for students. If they're waiting to be referred into the community or waiting to be seen by their own therapist, as Dr. Harline says, a lot of these students are coming in with prior history, and some of them are continuing with their therapists in the community, but their therapist is not available, so they come to us to see someone immediately. So that's the STEP model. We implemented the STEP model in the fall of 2020, and we are constantly adding more programs to it, more presentations, skills groups, group therapy, such as that. So that being said, now you know where we've been, what we're doing, but where do we want to go next? Our hope, wish, and desire from the board is that, as though we've been very fortunate to have Dr. Greer serve as our acting director. She's been extremely supportive and collaborative with us, especially as we transition to the STEP model. The counseling center still is an ever-changing body who really needs a full-time clinical director. A director who in the past, as we've had, can not only give direction to the department, but also support and student needs by also seeing students. According to the International Accreditation of Counseling Services, which is the only international organization that focuses solely on accrediting professional counseling centers on university campuses, it states that every effort should be made to maintain staffing ratios in the range of 1 FTE per every 1,000 students. In closing, I just wanted to kind of add to what the previous speaker talked about charter schools, how seeing students are coming to universities not academically prepared, which that impacts the counseling center. So as the STEP model allows us, a lot of times students come for counseling, not because it's a severe mental health issues, but because academically they're not prepared. And now they're displaying symptoms of anxiety, depression, concerns about what's going to happen in their life because they're not able to academically succeed in school. So our services help that process, but it's something also to know. And also that with COVID-19, we have gone from diagnostically, mostly depressions was the highest level of diagnostics. Now anxiety has superseded that. And sadly, this semester, at least myself, from my own sessions, I've seen a large number of students who are coming in who've lost family members due to COVID. And that's something I think the board needs to recognize. This is not something that's going to go away. This is going to increase over the next several years with us, that students are going to come to college the first semester with severe grief issues that will have to be addressed mostly with the counseling center. I want to thank the board for their time and consideration. Thank you. Any questions from any of us?
Couple of comments and questions on my time. First, from my side, first of all, thank you very, very much. This is a area and topic that we've recently discussed, and looking at the data that you presented, I noted that it's also old data in terms of the surveys and reports that we've seen. My point in saying that is I can imagine that it's only increased exponentially since then, because that's pre-COVID numbers in studies as well.
Yes.
I appreciate, I'm looking at, I have a lot of questions, but the STEP model, I think this is a really, really good. As you noted, we need to be able to figure out how we can most efficiently address the multitude of problems that we have coming at us. I also appreciate the comment about it just continuing to be exacerbated if we're having lower academic proficiencies that are coming in. So I understand. So you have 3 clinicians, one who started on the 29th of November. The document here talks about 1 FTE for every 1,000 students, and that's specifically clinicians, correct?
Yes, it is.
Okay. Very good. Have we done any studies with regard to how this also helps us from a retention standpoint? I mean, clearly, I remember back when I was in school, freshman dropout rates are very, very high. Most of these things can likely be addressed with appropriate counseling and access to those types of avenues. Have we ever looked at anything like that? Is there a way for us to discern that?
Absolutely. That was part of that 2017 JED Healthy Minds collaboration. So there is definitely a correlation in student mental health and withdrawal. And so the idea is that if we can support our students and help them either retain or obtain healthy mental health, there's definitely a correlation with retention with that. And then it goes so far as to say mentally healthy college graduates retain that satisfaction with their universities and are more likely then to contribute financially as alumni. So I don't know if that answered your question.
No, it does. And I'm sure, I mean, I have to believe that there's a very, very strong correlation for sure.
I believe it was on my previous slide. They're twofold. I think that was how they described it in our actual economic report that we received. They're twofold more likely. So if they have symptoms of or diagnoses of depression or anxiety, they're twofold more likely to withdraw. So that's a lot.
For sure.
Other questions or comments?
Thank you. I mean, the work that you do is invaluable for our students and ensuring that we have healthy minds on campus and people and our students are taken care of. So I wrote a note down here, firefighting, and I think it's an unfortunate circumstance that we've gotten ourselves into. We talked about having to take care of these kind of more immediate type of needs and the consistency of, kind of getting to the issues and the challenges before they rear their heads is becoming more of a challenge. So this was a very good presentation with great information and very timely. So thank you.
Thank you.
Okay, that was our last agenda topic. So if there's no other comments from the committee, I'm going to go ahead and adjourn our session. It is 9:37 and I'm going to officially adjourn the Northern Michigan Board of Trustees Academic Affairs Committee. Boom.